I'm one of the chiropractic physicians over at the World of Wellness, and welcome to Wellness Week 105. And today, the topic of discussion is going to be biomechanical magic for the holiday season. So basically today what I want to cover is some of the supplementation you could take for any kind of aches and pains, whether it's your back, elbow, shoulder, and some of the things that we do in the treatment room. And then kind of talking about certain different kind of like rehab and movement that you could do at home to prevent your injury, aches or pains from coming back here. So we'll just open up. I just looked up the definition of biomechanics, and the definition of biomechanics is the study of mechanical laws relating to movement or structure of living organisms. And the two biggest words in that is movement and structure. So being a chiropractor, everybody thinks that you go to a chiropractor just to get your back or your neck cracked. But my background is I am a chiropractor, but I also went for a master's in sports rehabilitation. So I'm huge on soft tissue because not only if we restore motion and movement to certain joints in your body, we also have to basically give you certain things to work on the soft tissue components as well, because joints, tendons, and ligaments and muscle is basically going to attach to an osseous structure, so like a bone or a joint. So if we just basically adjust you and send you on your way, you might feel momentarily better, but we're not out of the woods. That's only 50% of the battle, so to speak. We actually have to work on some of the soft tissue properties as well, just to make sure you make a full recovery. So just to kind of touch base on some of the supplementations and the protocols that I use for any kind of joint pains. Let's talk about structure first. So you have to have structural integrity, and one of my favorite go-to supplements is the HA Plus. And the reason I like the HA Plus is because it contains hyaluronic acid, glucosamine, MSM, and chondroitin. So if you actually look at the research, the pecking order of like what's the best for your joints, those are the top four right there. And Nutritional Frontiers makes it so easy for me as a provider and for you guys at home, the patient is, it's literally a comprehensive all-in-one. So a lot of patients would be like, well, hey, I'm just taking this chondroitin. Does this help? Yes, that will help. But again, Nutritional Frontiers makes it super easy because they literally put the four main things all in one supplement, and you're going to feel loads better. And so let's just dive into just some of the different things that like I see very, very common in the treatment room. Me being a chiropractor, let's just talk about basically the biomechanics of a disc. So this is basically a model of your low back. And when we look at it, there's like two main components. So you have something called a nucleus pulposus, and then you have something called an annulus fibrosus. So we'll just call it the jelly inside the jelly donut. And this is actually a model of a disc herniation. See plenty of people with any kind of disc problems, and then they feel the radicular symptom running down the leg, like, hey, doc, my back, kind of aches and pains, but then my leg's really, really lighting up. And so what we do in the treatment room is this is kind of like a two components to this. So you not only have a structural problem, so in a disc herniation, essentially what happens is you have 22 to 24 layers of these lamellar rings, and that's kind of like the donut. And when people have the pain, it's when that jelly squeaks out of the donut, and that's your disc herniation right there. And what happens is when someone says, like, I feel like I got a pinched nerve in my back or that sciatic's acting up, what happens is the disc property, that nucleus pulposus, it contains 8 main inflammatory proteins. We'll just call it chemical soup. And when that chemical soup hits the nerve actually swells 3 times its normal size. So when people are having a disc problem, whether it's a disc bulge, disc herniation, the chemical component will go onto that nerve, basically grow it 3 times its normal size, and that's when people start to feel the radicular symptom running down the leg. So what I like to do in the treatment room for any kind of disc herniation, disc bulge, or pinched nerve is kind of all in the same. We have to get you on an anti-inflammatory. So we were talking about the two components. It's a structural component because you have a micro tear in your disc, and then the anti-inflammatory, my favorite go-to by far is the X-Flame, and then the Inflam. And that is a very, very comprehensive supplement that's literally going to put out the fire, so to speak. So once you get the inflammation down from that disc and that pinched nerve in your back, you're going to have less of the radicular symptoms. And then what I like to do in the treatment room is we have something called a class 4 therapeutic laser. I could talk about that for about an hour, but essentially what that does is that decreases inflammation at the cellular level when we go over a certain spot. So that's basically going to help, quote unquote, shrink that nerve so you're not feeling the radicular symptom. And then those 22 to 24 rings, it basically helps to kind of mend that collagen back together. A lot of times people come in, they bring their MRI in. Hey doc, I have a disc herniation, L3, L4, L4, L5. Do I need to go for surgery? And my philosophy is surgery should definitely be the last thing. Try and treat it conservatively. So try your supplementation, try some movement, try and see myself or Dr. Orbach in the treatment room, just because there's a ton of different protocols. Again, with my background, very similar to physical therapy, and there's something called the McKenzie end range extension protocol. So a lot of people, when they think they have a disc herniation, I got to go straight for surgery. But I guarantee you, if you modified your diet and tried to have an anti-inflammatory diet, started taking some supplementation, and then if we got you to do the right movements to kind of help your disc reabsorb back into the disc space, you're going to feel a heck of a ton better. So if you have a disc herniation or a disc bulge at home, no, you do not need to go right for surgery. The success rate is miserable. If you actually look at the success rate for low back surgeries, any kind of discectomy or laminectomy, no bueno. So come in and get some treatment. And again, the supplements that I like for that is going to be the X Flame. That really, really helps just to kind of put the fire out, so to speak. And then I do love the topical CBD. So Nutritional Frontiers, I love their CBD. The main reason is it contains lipoderm technology. So if you've ever heard of any family member, friend that they basically go to an endocrinologist for hormone replacement therapy, sometimes your endocrinologist will actually give you a cream of progesterone or estrogen that you basically just rub on your skin, and you actually get the hormones through that. The Nutritional Frontiers has the same kind of technology with the CBD. So when you actually put it on your skin, it's not a placebo. It's actually driving into the tissue. And why I love the CBD is it's a massive anti-inflammatory and it's a neuroprotectant. So it will help decrease the inflammation of that disc herniation, that disc bulge, that pinched nerve, and then it's basically going to help to like reset the nerve, so to speak, so you don't feel it kind of leaking down your leg. So that's like, and again, it's, I wish I could show you guys, but like we go through the McKenzie end range extension protocol, and sometimes I only treat people like, I want to say 2 to like 4 treatments for their disc pain. And then if you're a good patient and you're good with your homework at home, I usually tell patients, bring in your phone, take a video of me doing some of these exercises and correctional movements, and they do this at home, and then I see them in a couple months, they're like, actually, I felt pretty darn good. I was able to get on the ground with my grandkids, able to go walk, I'm in the garden pain free. So my goal is, I love seeing people in this treatment in the treatment room, but I always tell patients, look, I want to get you better as quick as possible, so I could run into you at Giant Eagle or a concert. Because if you're in here, usually you're in somewhat of pain. So that's basically, in a nutshell, what we kind of do for the disc herniation back in the room. We also do a ton of soft tissue and a ton of stretching too, basically just to allow that nerve to breathe. And then if we're going to other biomechanics too, so just since I'm standing up and you guys can see my elbow, very, very common, people come in with something called lateral epicondylitis, and that basically is just tennis elbow. And that is actually kind of like an overuse injury, and you don't have to be a tennis player to get tennis elbow. A lot of people actually, believe it or not, are people that are working around 40 to 50 hours at a desk all the time, and you're just typing on your computer, and what happens is it's kind of like an overuse injury. So you have a couple different components there. So lateral epicondylitis, all that means is you have tight forearm muscles on the top of your forearm that are pulling on a bone, and it's creating inflammation. So my go-to supplementation for any kind of tendonitis, so lateral epicondylitis, medial epicondylitis, Achilles tendonitis, the suffix of that word being itis means inflammation. So the biggest thing is going to be the X Flame or the Inflam, and then the topical CBD works really, really well locally right there. And then also, too, what you could do is the green lip muscle, because that's going to help with the connective tissue functions. So what we do in the treatment room is we use that class 4 therapeutic laser just to kill the local inflammation. And then there's different things you could do to rehab it as well. So we like to do something called pin and stretch. So the overuse injury, those muscles are really, really tight, and they're pulling on that bone, and then that bone gets inflamed. You get inflammation there. So what we have to do is essentially put more slack in the rope. So we're going to try and basically release some of the tightness of the tissue so it's not pulling and basically making that lateral epicondyle angry. So we do that with the X Flame, I love the topical CBD, and the green lip muscle is going to be massive just to kind of help with the connective tissue because basically that tendon's attached in there and it gets unhappy. So we need to basically give that some support as well. And then there's simple, easy things that you could do at home too. If anybody's struggling with any kind of pain on the outside of their elbow, the best way to recover from any of these tendonitis or tendinopathies, if you will, is going to be something called an eccentric load. So an eccentric load is, think the concentric. So let's just take a bicep curl, for example. When you go to curl the dumbbell, that is the concentric motion, and then the lengthening portion is going to be the eccentric motion. And basically, to recover fully from any kind of like tendonitis, you have to eccentrically load it. So let's just imagine my arm was laying on the table here, and so what you could do at home is if you're dealing with any kind of like outside elbow pain. Very, very simple, like the rehab, like the physical therapy. If you go to physical therapy, they'd give you this, is what you're going to do is you're going to have your arm supported and you're going to do a wrist extension up in 1 second and then slowly lower for 4 seconds. And then you're going to go back up in 1 second and slowly lower for 4 seconds. And that is an eccentric load. And essentially that is going to be the gold standard to kind of help with any kind of like tendonitis or tendinopathy going on. That works well with Achilles tendonitis. That works well with quadricep tendonitis, and it works really, really well in the elbow as well. So I guess the point I'm trying to get across is if you do the supplementation protocol, which, myself and Dr. Orbach can definitely give you all the clinical pearls in the treatment room, and you got to be a good patient and do your homework because I love giving patients different stretches and exercises to do at home because, let's face it, there's only so much we could do if I treat you once or twice a week. Those other days at home, 5 or 6 days a week, you got to be doing your exercises and stretches just to make sure you make a full recovery. So yeah, any kind of tendonitis, the anti-inflammatories are going to be massive. And then a lot of people coming into, I used to play basketball, I used to play football. I've always had problems with my hamstrings, a lot of hamstring pulls. So if you're having a ton of different hamstring pulls, let's definitely assess your range of motion and look how you stretch and see how tight that hamstring is. There's multiple places you could actually tweak a hamstring, so to speak, but one of my favorites is I love getting people on the green lip muscle just because, again, that's going to help to strengthen that hamstring tendon that attaches to your ischial tuberosity, so hopefully you're not tweaking it as much. Another common thing I've seen the past couple weeks, just because basketball just started up, some of my college athletes coming in, chronically rolled ankles. So the most commonly sprained ligament in the ankle is something called your ATFL, anterior talofibular ligament. And once you sprain that, what basically happens is that ligament, it's supposed to be nice and tight, all the myofibrils like this. And so what happens is when you sprain it, it just gets a little bit elongated over time because you're having basically micro tears in that area. So I love the green lip muscle, and then I also love something called Ligaplex. That's by Standard Process, and that's basically just going to help with the integrity of tendons and ligaments, so you're not continually tweaking your ankle. So what I like to do with patients, I just had my D1 basketball player, he was just in Wednesday before Thanksgiving. I've been seeing him for his sprained ankle, I don't know, about 5 years now. It seems like once a year he's re-injuring that ankle. And we just recently got him on the Ligaplex and the green lip muscle just to help with the integrity of the tendons and the ligaments surrounding that area. And then I take them on something called, we have a vibration plate, and we'll have them do specific stretches and exercises on that, and it will increase something called proprioception. Proprioception is a fancy word for where your joint feels like it's in space. So we'll have them do different balance and exercises on this vibration plate, and basically just to kind of help strengthen everything around the area so he's not continually rolling the ankle. Going off topic from the biomechanics, if you have a son, a daughter, or a grandchild that's playing, middle school basketball, high school basketball, if you're chronically rolling your ankle, I get this question asked a lot, is should I have them in a brace? My opinion, acutely, yes. If you just rolled your ankle and is within 72 hours, I would highly recommend wearing the brace just because you still have tissue damage. But where I have a lot of fun is like after you're out of that first couple days, get them in the treatment room, and then we could do all the good stuff to kind of help strengthen everything up. Because if you're dependent on any kind of brace, right, like an ankle brace or if you have that lateral epicondylitis and you wear that brace all the time, that's good acute, but you actually want to strengthen everything around the area so your body's not dependent on the brace. Because as soon as you take that brace off and whatever you're doing, your brain's like, well, we have added support from wearing this brace, so everything kind of gets loose, and then you're gonna have more chronic ankle sprains. So I would say rule of thumb, acute wise, nothing wrong with the brace, but then like further down the road, you basically want to go to a chiropractor or a physical therapist that could kind of help strengthen everything around the area so you don't have the recurring injury. And getting back to, let's see here. What I wanted to talk about next too was the key for optimal biomechanical function. I like to have more active treatment as opposed to passive treatment in the treatment room. So the biggest take home that I'm going to try and get across today is for you to have perfect biomechanical function, you have to have movement. It sounds kind of cheesy, but movement is medicine, motion is lotion. If we go back to the low back, before I went to school, I had no idea what was going on with my dad's low back. So my dad was in the military and he was a tank driver, and he ended up having a disc herniation when he was in the military. And growing up in middle school and high school, he would always tweak his back about once a year, once every other year. And as soon as he tweaked his back, I was like, hey, Dad, just sit down. I'll finish cutting the grass. I'll finish, in the garden, whatever it was, just rest it. Now, after going through school and know what we know now, one of the worst things you could do for his joint is literally to rest, because then you're going to have all that tissue degradation and all the damaged tissue. It's not going to get flushed out. It's going to sit local at the site of your injury, and then it's going to take you way longer to get better. So a fancy word for motion, they call it imbibition. And so your low back, so like the vertebra and the disc in your low back, very poorly vascularized. They don't have a good blood supply. So the way that you could actually get blood and nutrients to your low back is movement. So a lot of my patients, if they have like an acute low back pain and they're like, yeah, it really hurts when I'm getting up and down from a seated position, in and out of my car, I usually just tell them to go for a walk. A 5 to 10 minute walk would do you a lot of good, just because, again, the more you move, it's going to flush some of the metabolic waste and some of the tissue degradation out of that area, so you could bring your good, healthy blood flow and your natural stem cells to the area so you could heal a little bit more efficiently. So I'm a huge advocate of movement. If you have an injury, I hate using the R word, rest, because I think that's baloney. Like, there's certain movements you could do that are not going to be painful, that will kind of help aid you to a full recovery, so you could be as optimal as you can. And a good analogy is that for that is like, where I live down in Monongahela, and I got almost 10 acres, and I got a 1958 Ford PowerMaster tractor. What's the worst thing you could do for that tractor is not run it. It's the same thing with the human body. If you have any kind of like joint dysfunction, whether it's neck, low back, elbow, shoulder, knee, one of the worst things you could do is basically just stop moving, so to speak, because then again, that all that tissue degradation and the metabolic waste is not going to get flushed out, and you're still going to have a painful area, and you just got to keep your body moving. I can't stress that enough, and that's one of the fun things that I like to do in the treatment room is we'll take you through like a functional movement screen, like an FMS protocol, see what you can move through pain-free, see what's provoking your symptoms, and then we could kind of start from the ground up to get you just basically being able to move, in pain-free ranges of motion, and kind of increase you up to getting back to what you normally like to do. So again, we do the functional movement screens, stretching, and then one of my favorite things for patients to do take home is, we're talking about biomechanics, and we're going to talk about the joint today, and then next Saturday I'm going to talk a little bit more about the muscles. But like kind of like essentially a stretch for your joints. There's something called a CAR. It stands for a controlled articular rotation. So that is basically stretching like for your joints. Everybody knows how to stretch your muscles to a certain extent, but if you're having any kind of like lingering, my elbow, it was hurting, it gets better, gets worse, gets better. Once I work on the soft tissue and the muscles, it feels a little bit better, but something always comes back. It could be actually a joint problem. So just very easy, since I'm standing up, we'll pick the elbow again. So a joint CAR, that controlled articular rotation, is essentially taking your joint through its full range of motion. So it's kind of like stretching for your joint. And just to show you the elbow one, so I like to have patients supported. So you'd be supported on a bench, coffee table at home, even on the side of your bed. Just make sure your proximal arm supported. And then to take your elbow through its full range of motion, you're going to go palm facing you all the way into flexion, rotate as far as you can all the way around, and then all the way back down. And then you're going to come back up like this. And it's basically just trying to kind of like lubricate your joints, just because you're going through the full range of motion. So if you have any kind of mild osteoarthritis, again, one of the worst things you could do is basically not take your joint through the full range of motion, because then your brain's going to kind of signal to that joint, hey, we're not going through its full range of motion. We could kind of cap it short here. And when we're talking about, I guess, joint lubrication, one of my favorites is we want to get the inflammation out. So natural anti-inflammatory like the Inflam. And then I also love the omega-3s. And why I love and recommend almost to every patient the Nutritional Frontiers omega-3Ds is, if we would go, if we're going to shop at Costco, if you look at their omega-3 brand, roughly 70% is actual fish oil, and then 30% is the omega-3s. So the fish oil is basically the filler. So that's why when people take like not too high quality of a fish oil product, they always complain about the burps, right? Like, oh, I took those fish oil, I can't take those anymore. I got that fish aftertaste, I'm burping it out. The cool thing about Nutritional Frontiers is roughly 85% of our omega-3Ds is your omega-3, so high in your DHA and EPA, exactly what you want, and roughly 15% is the fish oil. So it is very, very saturated with the omega-3s, the DHA and EPA, basically what you're taking the fish oil for, and has a little bit amount of fish oil. So not one patient have I had so far say that they take our fish oil and they actually get any kind of burp, just because it's very, very refined. And not only is that good for your heart and your brain, but that's really good for joint lubrication as well. So that's another one. Like if someone's had like a chronic problem, they tried like a natural anti-inflammatory, they tried physical therapy, tried a chiropractor, they do get better, but they don't fully get better. Like in their knee or their elbow, I would try and lubricate the joint with the omega-3Ds or the SPM. Actually, fun fact, Nutritional Frontiers was the first supplement company to actually have a liquid SPM in the whole world. That's pretty cool. And that's actually one of my favorite supplements to take now. I've had 2 shoulder surgeries, just chronic dislocation, and it bugs me every now and then. I try and keep it tight in the gym, stay active, but sometimes it will bother me if I'm working at my house. And can't make this up. Once I started taking the SPM, so an SPM stands for a specialized pro-resolving mediator. So essentially, in a nutshell, what that does is it helps basically resolve chronic inflammation at the cellular level. Again, if someone's about 95% better, and every couple weeks, every couple months, they keep having like a tweak in their elbow, knee, neck, that SPM product is one of my favorites. It's just crushes your residual inflammation at the cellular level. And it'll actually help to lubricate some of your joints too. And then lastly, what I want to talk on, just because almost everybody coming in says they have a problem with this, is arthritis. So when we talk about biomechanics, we would be remiss if we didn't talk about arthritis. And the two we're going to touch on today is osteoarthritis and rheumatoid arthritis. Both are completely different, and you treat them completely differently with supplementation and exercise as well. So osteoarthritis is essentially kind of like a wear and tear overuse injury. So if you were an avid runner your whole life and you hit the age of 50 and you're like, you know what, my knees are really hurting getting out of bed, or when I first started to run, like the first miles, I'm really feeling it in my knees. Basically, arthritis in a nutshell is your brain. If you're using your body a lot, right, and your knees are taking a pounding from running on asphalt, your brain's like, well, we're really abusing our knees here. We need to basically put more bone down in our knee to kind of support our skeleton. So basically what happens is your brain will start to, you'll have more osteoblastic activity. So that basically just means you're creating new bone, and you're going to put it where you're stressing your body the most. And so usually people will get it right in their knees, especially with running. And the biggest thing you can do with osteoarthritis, in my opinion, is going to be the HA+, so that's the hyaluronic acid, glucosamine, MSM, and chondroitin. That is by far the best joint support you could have, and then you're going to have an inflammatory response as well, so you got to get on the X-Flam or the Inflam. Those are my two favorite for osteoarthritis. And then if we go to rheumatoid arthritis, completely different animal. So Rheumatoid arthritis is actually an autoimmune condition, and it's an inflammatory arthritis. So the biggest thing for rheumatoid arthritis is everybody thinks let's just attack the joints, right? Like my neck's hurting, my thumb, my big toe. Most of your immune system, I would say, a ton of your immune system is basically located in your gut, right? So if you have rheumatoid arthritis, and actually me and Alicia are co-treating a patient right now. She was having multi-joint pain. So she was having pain in her feet. She was an old runner, her hands, and then her elbows started hurting. It just didn't make sense, right? So all of a sudden she just had a ton of different fires flaring up, and all her joints were killing her like crazy. She was basically unable to do what she wanted to do. Sent her for some lab work just because she had like basic lab work from her PCP, but it wasn't really reviewing anything. So I sent her for a little bit more extensive lab work. Long story short, came back that she ended up having RA, rheumatoid arthritis. And so what I recommended for this patient was, hey, we'll calm down the fire locally, but we got to take a systemic approach, and we got to really look at your gut, because most of your immune system is located in your gut. So the biggest thing that me and Alicia are doing for this patient is we got her on basically our GI protocol. So the GI Complete and the IgGs, absolutely massive for her gut. And then rheumatoid arthritis being an inflammatory arthritis, we have to get on an anti-inflammatory. So she was taking turmeric before, but we kind of upgraded it and got her on the X-Flame. And Alicia saw her last. I think she's down just from her diet. She's down 20 pounds. It was what, a month and a half? Something like that. And she was a huge runner. She would always do marathons, and she stopped running because her feet were killing her. And that's why I love when patients come in with just symptoms that you don't think you need to see a functional nutritionist or a chiropractor for. Because again, when you think chiropractor, you think spine, right? You're just going to treat neck or low back. But she was having problems with just multi-joints in her body. So we sent her for some pretty extensive lab work, showed her diagnosis, and now we're basically working from the ground up. So Alicia's helped cleaning up her diet. I think she is off any kind of gluten and dairy, which is going to help keep the fire down in her body. And then she's on the gut protocol, so she's on the GI Complete and the IgG. And then what we do in the treatment room is we use that therapeutic laser to kind of put locally the fire out in her foot and her elbow, and her hands are getting really bad too. And she's responding great. So there's two different ways to treat, osteoarthritis and rheumatoid arthritis. And I love when patients come in with any kinds of aches and pains, because myself, Dr. Orbach, and Alicia, we're actually going to get to the root cause and just not chase the symptoms. She was going to a chiropractor before that was basically just adjusting her feet and her hands and sending her on her way in 10 or 15 minutes. Yes, you're going to have temporary relief, but it's not going to be long lasting. You have to address the issue just because it's an autoimmune condition. So you have to address her gut. And then basically we're working on different supplements she could take, and different modalities that we use on her just to improve her quality of life. And so I guess that's what I had in a nutshell for the biomechanical magic for the holidays. Again, the take home that I wanted to have was, as corny as it sounds, motion is lotion, movement is medicine. Again, I don't like just like a passive treatment. Like I like to get patients moving and grooving, so to speak. So the more you move, the more your body's going to be happy, because again, if we look at the spine, it's poorly vascularized. So imbibition, so just basically moving is going to help get all the metabolic waste out of the area, and is basically going to help bring your good blood flow to the area so you could heal. And so that was basically the joint topic for biomechanics today. And then I'm going to be presenting next Saturday, same time at 11. And we're basically going to talk about just like safe and healthy stretching techniques you could do at home. Getting a little bit colder this time of the year, so everybody wants to get stagnant and not move their body. So what we'll do is we'll kind of just give a breakdown of like different stretches and exercises and movements that you could do at home, just so your joints don't get rusty, so to speak. So thanks for sticking by, and we'll see you guys next Saturday.